Hello everybody. Since a few months ago when it was announced that the total student debt in the United States reached the $1 trillion, there was a lot of political debate about it and a lot of backlash against higher education. In fact, now what we are looking at more carefully is the effects that this debt may have not only on the pockets of students and their families, but also in other areas of society, like healthcare. According to a study just published by the journal Economic Modeling, it shows that they were studying a group of Italian and British researchers how the hypothesis that was put forward by the 2001 Nobel laureate in economics Joseph Stiglitz, that was based on the idea that the cost of higher education and the debt of graduate students was going to affect society as a whole by reducing the prosperity of society. They look at this from the healthcare viewpoint, and they found that there was a lot of brain drain, that is, loss of people interested in particular areas of medicines moving into more private business, which in turn means that there were fewer people doing basic research that is so important in order to advance medicine and other health sciences. This is similar to the situation of lawyers who graduate with such a huge college debt that instead of trying to do some public service, they tend to go to big law firms in order to make the money that they need in order to pay for this type of debt. Not only that, but also we are seeing how more and more these particular graduates in medicine, for example, go to those specialties that they know are going to produce a lot of money for them very fast, such as, for example, neurosurgery, urology, or plastic surgery, which in turn means that fewer people in areas that are essential in today's society, like primary care specialists, pediatrics, or medics in rural areas. At the end, this creates an imbalance in the healthcare system because we have a lot of people in areas for which we don't need that many, and a lot of people fewer in areas for which we need a lot. In other words, we need a better funded higher education system so we can correct these imbalances in society. Thanks for watching the Romero Report, and please remember to like, subscribe, and comment, and let me know what you think about the impact of student debt on the healthcare system. And next week, we'll be talking about how higher education actually is good for your health. So stay tuned.